Tuesday, January 12, 2010. An earthquake measuring at a magnitude of 7.0 on the Richter scale struck the country of Haiti. The devastation brought upon the earthquake resulted in unimaginable destruction of buildings, businesses, and the lives of many people. Although the earthquake lasted for less than a minute, the impact affected this nation's citizens physically, mentally, economically, and emotionally. It has been calculated that during the aftermath, 1.5 million inhabitants have been displaced all over the country, 230,000 individuals lost their lives, and 300,000 left severely injured, with the death toll still rising. In addition, the earthquake resulted in 105,000 homes being destroyed, causing $2.3 billion in damage, and a nation being covered in rubble. Based on the severity of the situation, the impact of this natural disaster has caused many to wonder, how could such an event occur, and could this ever happen again? In order to understand this phenomenon, we have to look into the science behind the story of earthquakes and understand its destructive nature. To help us is Dr. Danny Jacob, a seismologist at Ontario Tech University.
To understand how earthquakes form, we must go deep into the earth. The earth is made of an inner core and mantle. The final layer is a thin crust covering the mantle, which acts as the surface of the earth, which includes oceans and continents. The crust is made with the separate rocky portions called tectonic plates, which lie on the mantle. These plates are constantly moving around. Some slide past each other horizontally, some push together and force the ground upward, and some slide beneath another plate and some pull apart. However, when a tectonic plate moves suddenly, it causes friction with another plate, or the force of two plates build in pressure and suddenly release. It causes a variety of effects, which includes unnoticeable mild tremors to violent prolonging shaking. These characteristics ultimately led to a shock wave which radiated from underground to the Earth's surface, thus causing what is known as an earthquake. Unfortunately, it just so happens that Haiti fell within the proximity of both the North American and Caribbean plates, making them the first country to experience a quake straight. As a seismologist, it is my job to gather data and determine where the earthquake's point of origin. In doing so, allows us to understand where the contact occurred, but as well as allowing us to predict any future earthquakes.
Despite the efforts to gather data on seismic activity in this area, another problem has risen. It is one of biological terror that has not been seen in Haiti for over a century. A cholera outbreak has occurred, and it has been proven to be very problematic for personnel to aid in the recovery of Haiti. The disease has already claimed the lives of 4,500 individuals, and more cases are being seen. Dr. Samantha F, an epidemiologist who has mastered the art in determining the etiology of diseases, has examined how this reemerging infection showed up.
Cholera is a type of bacteria that thrives in unsanitary waters. Now, when someone gets infected by the bacteria, a person will show signs and symptoms of vomiting, diarrhea, and even fatal dehydration. Now, cholera is not that big of a deal in developed countries. However, in Haiti's situation, being one of the poorest nations in the world, they have a relatively weak infrastructure, crowded conditions, as well as an unrepairable water treatment system due to the earthquake. As a result, these factors have given the birth to the perfect hotspot for the organism to do its job. Due to the lack of sanitation and access to clean water, a rapid spread of the disease became prominent in just a small nation in such a few little weeks. In a sense, if the earthquake is being described as being shot point-blank range by a gun, then the conditions that brought upon the reemergence of cholera can be described as the finishing blow.
Due to the earthquake and the onset of a deadly disease, humanitarian aid has come to the rescue. With the release and support of many services, the Red Cross and MSF, also known as Doctors Without Borders, has acted upon themselves and initiated a plan of action to get the citizens of Haiti back on their feet. MSF played a big role in providing medical services after the occurrence of the Haiti earthquake. Doctors Without Borders team lead, Aliyah L, landed in Haiti days after the earthquake, only to see the capital of Haiti, Port-au-Prince, in ruins.
I was part of the MSF for about 10 years of my life. Our team has been providing services to Haiti for about 19 years prior to the earthquake. We had just been called a few days after the incident had happened, and we flew to provide as much help as we could. I remember when I first landed in Port-au-Prince, I was in absolute shock at what I've seen. I couldn't have imagined what these individuals have gone through. My heart broke for the individuals who lost their homes, families, and more. The first thing that came into my mind was that we needed to seek out as many injured survivors as we could and provide food, water, and sanitation. Providing emergency medical services such as mental health, primary health care, and providing mobile clinics was our first priority in order to get the affected individuals in Haiti back to their norm. One of our goals was to create a new facility that would provide care for the wounded and provide life-saving surgeries since many of the existing health facilities have been damaged. In total, we were able to provide emergency medical care to approximately 200,000 patients. Many maternity hospitals were destroyed, in which we did our best to provide support to the ministry's maternity hospital and provide personal and critical medicine. We were able to deliver 3,752 babies in all facilities within the first 5 months after the earthquake. There were many individuals who I had spoken to who had lost their loved ones and suffered from trauma. I thought psychological care was important to address the effects of mental health. Able to include things such as group counseling sessions and individual consultations, which were aimed primarily at reducing the anxiety that came with losing a loved one, coping with injury and poor living conditions, and the fear of an aftershock. Primary care was important, which included basic checkups and monitored health problems within the area. These services included postnatal care, vaccinations, and infection treatments. Since many of the living conditions had already been destroyed, we made the effort to improve living conditions for the displaced and offered tents, shelter, cooking materials, and sheets. It was definitely not easy being able to provide these services in Port-au-Prince. We did have some major challenges, one being the challenge of finding landing spots for planes which carried all of the medical supplies and personnels. Planes often diverted into the Dominican Republic, so supplies had to be brought to Port-au-Prince by car, which ended up taking an additional 36 hours. It has been such a life-changing experience to have been able to contribute towards trying to rebuild a life for the victims of this tragedy. It's such a blessing knowing that we were able to provide a variety of services, and from now on, we are ready to be deployed at moment's notice, and we will continue to do our best to deliver life-saving care.
Haiti is well on its way to becoming an original nation. Needless to say, there's a lot of work that needs to be done. Over time, the country with Haiti will have to come together as a community and rebuild on their own. Although they are identified as a country of poor economic status, their determination to live a normal life represents that nation with the strength and courage to keep fighting for themselves and each other. As citizens of Haiti turn a new leaf in their cycle of life on the surface, shifts in the Earth's crust below continue to move. It is only a matter of time before history repeats itself. And the question remains, when that time comes, will they be ready?